Good afternoon, everyone. My topic for today is comparison of ocular surface changes in operated.
I just mentioned that your paper is not going to be marked because you are a non-ratified member. That's been mentioned in.
Yes, ma'am.
So
Yes, I'm aware of it. Yes, ma'am. We have no financial interest in the presentation. So dry is a multifactorial disease of the tears and ocular surface that results in symptoms of discomfort, visual disturbance, and tear film instability with a potential damage to the ocular surface. In recent years, because of the living standard, popularity of the computers, and impact of environment, the morbidity of the dry is around 32%. The diagnosis of dry is mainly by the clinical presentation and by the basic test, that is TBUT and the Schirmer's test. So in our study, we did a dry workup of patients undergoing strabismus surgery and compared it with the unoperated eye at the end of 1 month post-surgery. Strabismus, as we all know, is defined as the misalignment of two visual axes, that is deviation of one of the eyes. Strabismus surgery for exotropia comprises of lateral rectus recession and medial rectus resection. The muscle may be approached via limbal or fornix route. In our study, we took out a total of 50 patients in the age group of 15 to 40 years who had intermittent exotropia was chosen. Fornix incision was taken on conjunctiva to explore the medial and the lateral rectus. Lateral rectus recession and medial rectus resection were done in all the patients. The patients who were excluded were patients having ocular disease like blepharitis or lacrimal system disorders, ocular surface abnormality, and history of diabetes, hypertension, collagenous disease, and use of topical or systemic drugs. Patients who had undergone LASIK surgery were also excluded to prevent, because these patients may have tear film abnormality beforehand. Schirmer 1 and 2 tests were done and TBUT tests were done. Normal value of Schirmer is 20 mm and TBUT is more than 10 seconds. All the patients showed decreased value of Schirmer test, both 1 and 2 and TBUT in the operated eye. Almost 46 patients out of 50 patients showed severe reduction. There was no significant difference in P value of the non-operated eye after 1 month of the surgery. However, there was a significant difference in P value of the operated eye pre and post-operatively. The mean values are as shown in the table. So we can see that in the pre-operative and post-operative period, after 1 month, the eye which was operated, it had significant difference in both Schirmer and TBUT tests. So the possible reasons because of which it can happen, we listed them as follows. There might occur blink-related microtrauma at the site of the conjunctival fibrosis after the conjunctival suturing post-Squint surgery, which can cause goblet cell dysfunction. The function of conjunctiva to act as a reservoir of tears is disturbed due to the conjunctival insult post-strabismus surgery. There is a complex interaction. These are the reasons because of which there can be the incidence of ocular surface disease can increase post-Squint surgery. Third one is there is a complex interaction between the afferent sensory nerves of the ocular surface and the efferent autonomic nerves to the lacrimal gland that modulates both tear composition and the secretion. Any factor that disrupts this relation will lead to tear dysfunction. Conjunctival inflammation caused due to the conjunctival incision that we give during the surgery. Conjunctival microtrauma can cause tear hyperosmolarity, secondary to tear film instability, which can further increase the inflammation and damage the ocular surface. If dry is caused by preservatives that are used in the medicines which we give post-surgery, then if we stop the medicines, the problem should resolve. So this is a vicious cycle of the ocular surface, the cause of the ocular surface disorder. Dry, so it is characterized by aqueous tear deficiency or excessive tear evaporation at the ocular surface, both leading to tear film instability that results in ocular surface epithelial damage. In addition to the lacrimal gland and the meibomian gland, conjunctiva also contributes to the formation of tear film by the production of goblet cells, derived mucin, and the expression of membrane-associated mucin. So when the conjunctiva is cut, this thing gets disrupted, and which can cause dry eye. Conjunctiva can be linked with dry eye through various mechanisms like inflammation, disturbance of tear film, and conjunctival fibrosis, as I mentioned before. So long-term follow-up of these patients, and especially patients who complain of ocular discomfort, is needed to know if the complaint resolve or become worse. Dry is increasingly becoming a problem due to the increased use of laptops and mobile and lifestyle changes. Strabismus surgery can aggravate this problem due to the above reasons. Hence, lubricating drops can be tried on follow-up, and Shermer's and TBUT can be repeated to know if there is an improvement. So it can be concluded that ocular changes do occur after, have occurred, like in our study, they have occurred after 1 month post strabismus surgery. Long-term lubricating drops can be prescribed, and the results can be compared using Shermer's and TBUT. A 3-month follow-up should be, we have only done 1 month follow-up, but 3-month follow-up should also be done, and the test should be repeated on all follow-ups, and results should be analyzed. So the take-home message is, if any patient post-Squint surgery is complaining of foreign body sensation or irritation, we should be aware that there can be a possibility of dry eye, and it can be treated on similar lines. And it has more future, it has a more scope of future research. Thank you.
Did you compare between the two eyes at the end of 3 months or 1 month? Like you've done in
At the end of,
post and both, but
yeah.
between the two eyes at the end of 1 month, did you?
Yeah, between 2 eyes at the end of 1 month. Yes, ma'am. Yes. Yes, we do.
Doctor, what is your post-op regime? Do you give lubricants in this 1 month, or is it just, what is your post-op regime for?
So, ma'am, in these patients, we have not given, we just give steroids, like antibiotic and steroid composition.
So your phonics-based incision was purposely done for this particular?
Yes, ma'am.
Limbal incision?
Yes, ma'am.
Not
Yes.
And also specifically choosing only the intermittent exotropy?
Yes, yes, yes.
To keep a balance?
Yes.
Otherwise there is
There was no relation between exotropia or, yeah, esotropia. Yes, ma'am.
purposely took it just to keep it.
Yes. Yes, ma'am.
But 3 months should also be done. Like
3
you said, because
yes.
after stopping the drugs,
Drugs.
definitely it will improve.
Yes.
Why did you not carry for the month? Your
Ma'am,
time was less?
yes. And the follow-up of the patients was not very frequent. Like they lost to follow-up after 3 months. So. Thank you.